Hey guys, Ivan here with the Dental Assisting Program, and today I'm going to be taking you through what is the dental operatory or the dental treatment room. Anytime you're coming into this room, you're going to want to start off by washing your hands. That's going to be the common theme around here. Anytime you come into a room, anytime you leave, we're going to wash our hands. So to activate our hand wash stations, we have kind of a pretty cool system set up here. It's a touchless system, so you're not contaminating your hands. So what you actually do, and it works the same on both sides, is you have to make sure that this handle is up, and typically it's always up. You just lean your leg right into it and the water turns on. Same thing on the other side. Lean your leg into it, water turns on. Soap is dispensed here, and then paper towels are right underneath. So anytime you're coming into the treatment room, wash your hands. We'll definitely cover what the appropriate hand washing technique is. If you have any questions, ask your instructor, but we'll make sure we cover that in our training as well. Let's go ahead and move on into the treatment room. So one of the biggest things that you have to become familiar with in the treatment room is the chair. There's 3 different types of chairs in the treatment room that we're going to be utilizing. Typically, if it's set up for a right-handed operator, we have the operator chair on the right side. Patient's chair will always be on center. And then we have the dental assisting chair right over on the side here. I'm going to go ahead and don some gloves. You don't have to do this, but I'm just going to don some gloves because I'm going to be touching everything. By now we've washed our hands and we're starting to get things set up for today. So the first thing I'll explain is going to be the operator chair. You'll notice that the operator chair is much lower than the dental assisting chair. It works on a swivel, it has wheels, so you can move around and maneuver yourself around the patient. Very important things about the chair. You want to make sure you focus on ergonomics. You'll notice that we have levers over on the right side. The one that's furthest to the back will adjust the backrest and allow you to tilt forward or back. And then we have the lever that will drop the chair or it'll lift it. So typically starting it up in the highest position and then working your way down is the best way to find a good position to seat in. You want to make sure that your legs are parallel with the floor. In other words, you shouldn't be up too high like this. You shouldn't have your legs where you're kind of at a decline, and you shouldn't be on your toes as well. So you want to make sure if you're operator or on the provider side, your legs are parallel. Then you have easy maneuverability, and you can have access to different areas in the treatment room.
Is also the dentist.
Sorry?
Operator is also the dentist.
Yes. So Rosemary has just pointed out a very important point, that the operator is also the dentist. So you might hear provider, you might hear dentist, operator, but mostly it's going to be the dentist on this side. The other chair that we have, and I'll switch places with Rosemary, is the dental assisting chair. This one's a little more complex than the operator chair. You'll notice it has this abdominal bar here, and that it has a ring around the bottom where you'll be resting your feet on this. Something that you'll be learning in the next couple weeks is that the dental assisting chair is meant to have the assistant at a higher position, or 4 to 6 inches above the operator or dentist. So you can maneuver yourself into the chair. I would say that this is a little low for me. You can adjust this to rest your arms. You're going to be resting your arms here so that you're not arching your back and hurting your back, because that's bad ergonomics. Remember, you're going to be doing this about 8 hours a day, so you want to make sure you use proper ergonomics. You want to have your feet resting on this bar. You don't want to have your toes pointing down at the floor like this, okay? You want to have your feet on this round piece here on the bottom, and then you want to use this abdominal bar so you can rest your arms forward. Anytime you have to exit the room, you simply swivel this over, and then you stand and you walk away. Just like the operator chair, we have an adjustment lever here. The best practice with this is to bring it up as high as possible, and then adjust down from there. So slide into the chair, bring the abdominal arm over, and then, depending on how tall or short the dentist or operator is, you'll have to make adjustments to make sure that again, you're at that bird's eye view or 4 to 6 inches above where they are. Now, the reasoning or logic behind that is that you want to have visualization, of all of the instruments, the patient, the dentist, and basically all of your surroundings in the dental operatory. So you're basically the eyes and ears for the dentist, while the dentist is focusing on the patient. So that is the assistant chair. We'll make sure we cover that more in class when you're in here with your groups. So everybody's going to get a chance to practice using these. So that is the assistant chair. We've talked about your operator chair. Now we're going to move on to the patient chair. The patient chair is probably the most complex set of equipment in the dental operatory. It is operated with both electricity and air, so you'll notice we have air compressors, and we'll learn about that in your lecture as well. You'll learn about the delivery system, you'll learn about the light, you'll learn about correct and incorrect positioning, you'll learn about how to turn these lights on and where to focus them. So the lights are operated with this on and off button here. Right down here is how you turn it on and off. On the back here, it has a button that adjusts how bright or how dim the lights are. You can dim them so they're not too bright, and they actually have a setting where the light is yellow and it's filtered light so that it doesn't cause our materials to become hardened, because some of our materials are light sensitive and they start to chemically change when they're exposed to light. So that's why we would use that setting, and you'll learn more about that in your lecture as well. To turn it off, simply push this button and the light turns off. There are several ways of operating these lights. There's actually a button on the delivery system here that the provider or dentist can use to turn the same light on. And they can go through all of the same functions by pushing the button again. You can dim it, you can change the filter setting, and then to shut it off completely, you just hold the button down and that turns it off. So that's how we operate the light. You can operate it on the provider side, you can operate it here, or you should also be able to operate the light right over on the assistant side as well. You'll notice there's a light bulb button. Okay? So next I'm going to move into actually setting up the chair for the day. Something that is very important is that we don't forget to pull out what's called a rheostat, or the foot pedal, which is used to operate our hand pieces. You'll learn about hand pieces and what they do, but again, those are also air driven. There will always be a paper towel under the foot pedal or rheostat when you come in the morning or whenever you start your day. Pull that paper towel out. We're going to throw it in the garbage bin. There's a place here next to the sink where we throw our paper towels and any other trash that we accumulate. The foot pedal typically will rest here in the center. Once the operator comes in their chair and gets in their position, they will tend to move it into a comfortable place where they'll be comfortable using it, where it's ergonomically correct for them. They're comfortable and they're not hurting themselves. So let's move on to actually now using the patient chair. When you bring your patient back, as you can imagine, we're not going to try and get them to leap up onto this chair. There's a couple things that we want to do. First and foremost, we're going to bring this delivery unit down to our level. The first thing you'll need to do is turn on this switch. This is called the master switch. By turning this on, we're activating the power in the air that it takes for this set of equipment to operate properly. Now, this button here allows you to easily move the delivery unit up and down. You'll notice that there are buttons on the delivery unit. This is how we're going to move the actual chair up and down. Here we have an up arrow and a down arrow. So simply by pushing the down arrow, the entire chair is going to drop. You'll notice there are buttons all the way at the bottom. Those buttons are meant for presets for when dentists set these chairs for their specifications. A tall dentist will have different specifications for this chair than a short dentist. So we're not going to mess with those because these are going to be used by yourself and your classmates. So we're not going to want to mess with those. We're only going to want to use these middle buttons here for bringing the chair up and down, and then also for laying the chair back or bringing it back into the upright position.
Which ones again?
So these middle buttons here are all that we'll be using to bring the chair down or up, or for laying it back or bringing it into the upright position. Something to pay attention to when you're working with these chairs is that this rear tray is not directly behind the chair. You could imagine you're bringing this chair down, you're going to run into this, or your patient's head is going to end up hitting it. So you're going to want to swivel this out of the way. You are going to be basically messing with everything that we have in here. We want you, this is your time to be nosy and learn about all of the equipment. We want you moving things around. We want you exploring and changing the positions. Something that's very neat about our setups is that they're universal. Now, what do I mean by universal? That this room can actually be used by a left-handed or right-handed operator. Currently, it's set up for a right-handed operator. If we wanted to set up for a left-handed operator, we'll move the assistant's suctions and air water syringe over to our side, to the assistant side, and then the dental operator chair or dentist chair would have to be switched with the assistant chair. We basically would swap everything over. This arm here, we would push the button, and then we would switch the delivery system to the opposing side, and then it would be set up for the left-handed dentist. So when we have you guys come in on your first Monday, we're going to have you going through all of this. You're going to be pushing a lot of buttons. I promise nothing is going to explode. We want you to get in there and get comfortable with turning the lights on, bringing the chair up and down, laying your patient back, all of that good stuff, okay? The next thing that we have to get you familiar with as well is where do we keep all of our stuff. So here we have some drawers. It's important to note that the drawers on the left side are for dental assisting students. The drawers on the right side are for the dental hygiene students. We don't use their items, and then they don't use our items, because we use different sets of materials and instruments as well. So at the beginning of the day, this will all be locked up. All of these drawers and cabinets are going to be locked. So either one of the students or your instructors will open up the drawers, and then you'll be able to access your supplies from there. So I'll just show you an example of what we have in here. Something you're getting in your take-home kit is your HVE, or high volume evacuator. We have some aspirating syringe tips for anesthetics. We have tips for our air water syringes, and much more that you'll be exploring and you'll get to learn about when you come in on Monday. So those are our drawers that we have to make sure we look up at the end of the day. Above here is where we keep our barriers. So we're not going to necessarily be learning right away how to cover barriers, but I want you to know where they're kept. So here we have basically plastic barriers that we use to cover all the surfaces that we're touching and contaminate. Close up there. On the left side here, we have some more cabinets where we keep extra gloves and masks. When you come in Central, in the Lab Central, or Clinic Central, excuse me, we'll have PPE for you. But when you're working in this treatment room, we want you drawing gloves from this cabinet here, not going back to Central to draw your PPE. Okay? That pretty much covers it. These are the 3 chairs. We know how to turn our master switch on and off, which operates the chair. Now, it is important to note that there is another switch under this unit here that allows us to have function of our air and water syringe on this side of the chair. The switch is right down here. It's basically directly in front of this bar. You just reach down below. You know you've turned it off when you hear that air exhaust come out. And we'll get to mess with all of those. We'll actually start working on each other before you know it. Initially, we just want you to turn everything on and off, push the buttons, get familiar with everything. That pretty much sums up the introduction to the dental treatment room or operatory, and we look forward to getting you comfortable to working in these rooms.